I want to remind my colleagues that the president is absolutely correct. He's correct when he says that Obamacare is about so much more than some flawed website. It's about people. People like the California woman with stage 4 gallbladder cancer whose story we read about in the Wall Street Journal just this past weekend. I'd like to read some of what she wrote. I'm a determined fighter and extremely lucky, but this luck may have just run out. My affordable, life-saving medical insurance policy has been canceled, effective December 31st. Here are the impossible choices she says she's left with. She can either get coverage through the exchange and lose access to her cancer doctors, or she can pay up to 50% more, as she put it, the privilege of starting over with an unfamiliar insurance company and impaired benefits. And Mr. President, that's just not right. It's not what the president promised, and it's not the kind of health reform Americans asked for. So we should keep our focus where it belongs, on the real people getting hurt by this law. But that doesn't mean we should stop asking questions about healthcare.gov, too. Because if the government can't even run a website that it had 3 years, and hundreds of millions of dollars to create, can Americans really entrust the same bureaucracy with even more power over their health care? The calamitous rollout reminds us that we do not even know if data being submitted over this website is 100% secure. And in today's age of digital scammers, there's a real concern for my constituents. Identity theft is about the last thing Americans need to be dealing with right now, especially with everything else this economy and this law have been throwing right at them. They're really mad enough about the president's repeated, unequivocal claims of, if you like it, you can keep it. The White House keeps trying to message its way out of this whopper. But no matter what they say, the reality remains. People are getting hurt. People are getting hit with premiums they can't afford, and millions are losing the coverage that they like. In my home state of Kentucky alone, 130,000 individual policies and 150,000 small group policies will be canceled. And remember, the president assured Americans up and down that this wasn't going to happen. I read about one D.C. woman who just lost her plan. She found something comparable on the exchange, but it cost a lot more than what she had before. And here's what she said. It's just not fair. It's ridiculous. Well, she's not alone. So I'll say again, it's time for Washington Democrats to work with Republicans to start working for their constituents instead of thinking that their first priority is to protect the president and his namesake legislation.